Well, this is the latest that's coming in from the Airport Authority of India that has laid down guidelines that airports must follow when a decision is taken finally to open up these airports. So not right now, but when in a post-lockdown era, airports do get a permission to open up and start operating flights, there will be a certain set of guidelines that will have to be followed. We'll go across to Ayushman to actually get you more details. Largely, these airport operations to begin with will be limited to Tier 1 cities, which is your big cities with a certain amount of population. Only those cities will actually see operation of flights. We've also been given to understand that to begin with, there will only be 30% of the capacity operational and not more than that. Remember, in the last couple of days, we've got you pictures of various airports preparing for a post-lockdown era with social distancing in mind. They're actually drawing these squares all over the airport, ensuring that the chairs are kept apart. And that is how the airport social distancing will be maintained. So for now, what we know is that for airports with more than one terminal, to begin with, only one terminal will be made functional. 30% of the capacity of the airport will be used. All social distancing norms will have to be followed, and all of this will only happen in airports present in Tier 1 cities. Good evening and good to have you with us in this edition of the Urban Debate. Tonight, viewers, we are going to begin with the focus on what is the most essential part of our war against coronavirus now. After 40 days of a lockdown period, after managing to reduce the number of cases, bring down the rise in cases, contain the infection and save many lives via this lockdown, the way things stand, there are 15 big districts and amongst them 7 of India's biggest cities that largely have over half the cases currently in our country. So from here on, if we have to discuss the way forward, if we have to talk about what should be the strategy, if we have to talk about strict lockdown restrictions versus partial relaxation, these are the 7 cities that form key to our battle against coronavirus. Now let me take you through that list. Delhi, that has about 10.5% of the cases of the country today. Right on top of that list with Delhi is Mumbai with the highest number of cases in the country. Mumbai accounts for about 19.4% of the cases in the country right now. Amongst the new entrants in the city of in the big cities that are now hot spots and red zones is Ahmedabad. Ahmedabad has seen a significant rise in cases in the last few days and now consists of 8% of India's cases. Hyderabad has about 1.74% of the cases. Indore is another very interesting story. And tonight we are going to focus on some of these city-specific stories as we talk about the larger battle against coronavirus. Indore has seen 4.6% of the country's cases. It's in a state of complete lockdown for a really long time now, both Bhopal and Indore. And yet the problem continues. And then we have another new entrant, Jaipur, with 2.72% of the cases, and Pune, 3.69% of the cases. We also have, outside of these 7, one city which has become a growing concern. Every day registering 80 to 100 cases is the city of Chennai. And viewers, these are going to be the cities that become the come under spotlight for us tonight. Because if we can manage these cities now, then we would have won half our battle against coronavirus. Just to give you a sense, total cases in India stand at 31,787. That's the total number of cases in our country right now. Of that, in the 7 key battlegrounds, we have 16,089 cases. That's 50%, 50.61% to be precise, of the total cases. So let's talk about these metros, how to handle these cases, these specific cities, what can be done, what's the way forward. Let's say good evening to Kovai Satyan, spokesperson for AIADMK, Jasmine Shah, spokesperson for the Aam Aadmi Party, Dr. Hemant Bhatt, he's the BJP media convener for North Gujarat and a senior leader of the BJP, Dr. Anant Bhan is a researcher for global health, bioethics and health policy. Dr. Mangesh Pate, chairman of the IMA Hospital Board of India for Maharashtra, and he is also a member of the IMA National COVID Task Force. Dr. Mangesh, let's begin with you. If you can actually, shed some more light on these key cities and how they have become the biggest hotspots for coronavirus, and if there is a policy that we should look at to tackle these cities now.
Yeah, definitely. What we are discussing right now is about the urban areas, metro cities. And as far as urbanization is concerned, the population density, there is a main cause what we are seeing the concentration of these cases around these metros and the cities. That is the main reason. Second thing is, as far as this epidemic is concerned in our country, we definitely entered into lockdown. But the implementation of lockdown in these areas, when you go to the local civic body level, there are slight issues. I'm sure Indian government as well as the state governments, they are coming out with the very proper guidelines time to time again. But when it comes to the civic body levels, local levels, the implementation of these guidelines, there are some lapses. And definitely this is contributing to the increase in numbers of the cases in these highly dense areas. Thank you.
Okay, I want to just begin with a larger viewpoint, and then we will actually take up some of these cities in details, because each city is a different story and a different lesson, viewers. But let's actually also talk about a battle when it comes to crowded clusters and big cities and the infrastructure that's available. Dr. Bhan, Mumbai and Delhi have been dealing with this challenge for a while, and so is Indore to a certain extent. But the Ahmedabad and Chennai are actually now cities that have seen a significant rise in cases just in the last couple of weeks. How do we deal with this?
Thank you for having me. So I think the challenge is going to be extremely, an issue in these kinds of urban settings. As you rightly pointed out, probably the larger metros which had an influx of travel from abroad were the initial ones to have the higher number of cases. Now we are starting to see it in the smaller metros as well. Cities like Chennai, I think, also had international travel earlier, but didn't face the brunt of the pandemic earlier. Now, all of these urban settings are settings where there is usually a lot of economic migration into the cities and also economic out-migration once, situations like this happen. There is also a high density of population, especially in urban clusters where there are slums or low-income population households. And that, I think, becomes a propelling factor for the spread of the pandemic. The fact that physical distancing cannot be imposed as strictly as you might be able to do in a rural setting where there is lesser density of population is a factor. The fact that probably we didn't move fast enough with testing and isolation in the early stages, and maybe there was some degree of complacency in some of these settings which had seen lesser number of cases initially, could be a factor. If anything, we have learned from the Singapore experience, from the South Korean experience, from the German experience, it is that you cannot let your guard down. You really need to be very watchful, because even if you are having a low case count, the rebound or the rapid spread of infection could be very fast. And I think it is a reminder that any part of India could see a increase in the number of cases, and especially so urban settings are going to be a challenge from a logistical perspective in responding. So it's imperative that in our public health response, we remain alert in whichever part of the country we are, and then we have a specific plan to respond, which takes into account the local contextual factors. So I think each of these cities will then need to have its own response, which they can learn from what has worked in other settings, but it needs to be individualized to their particular settings.
Okay, so let's talk about some of these cities, and one list about the main 7 cities is what we've picked up from what was shared actually by the Niti Aayog CEO, and he put out a list of 15 districts. 7 of those at the top of the table were actually these main cities. Adding to that will also have to be Chennai, Kovai Satyan, because something odd seems to be happening there. Chennai or the entire state of Tamil Nadu actually didn't see too many cases in the beginning. Then yes, some of those cases of people who traveled from Delhi after attending an event came, and then sudden spike of infection happened. But what's happening in Chennai now? Why are we suddenly seeing this rise to the point where you've had to come out with a special set of restrictions for 3 districts, including Chennai?
Yeah, good evening, Tanvi. So let me put across some positive numbers to start the debate. With respect to the number of COVID cases in Tamil Nadu, there are only 865 active cases as of today, which puts us as 2.72% vis-a-vis with the overall Indian population. And Chennai stands at 768, which is in total from the day one till date. So the state has the highest number of discharges of people who have been treated with COVID. The state stands at 56.75% of discharge ratio after treatment. So that puts my number of Chennai to close to about 440. Yes, what you said is right. Suddenly there is a spike in the number of cases. But if you look at the global phenomena, once the outbreak happens, and when you increase your testing parameters, when you increase your testing, that's how the curve behaves. Then you see a number of cases sprouting here and there, and you put your containment measures there, and that's how the curve gets flattened. So that's precisely what's happening in TN as well. Now TN now close to about 1 lakh of testing is being completed as of today. From where we were about 30K a couple of weeks earlier, now PCR test itself has crossed 1 lakh milestone. So which means that we are on par with the global average of 2% of the COVID. So that puts us in a little bit of a comfort zone. However, the number of tests averaging today is almost at 7,000 PCR tests, out of which 50% is attributed only to Chennai, which means that Chennai zone has got about 3,000 tests being done every day. So which means that you can see the number of positive cases being, surging a little bit high, close to the 100 numbers, 90 or 100 numbers. And that's how the global phenomenon is all about. So you increase your number of tests, you identify your containment zones, do the testing properly, do as much as testing as positively, you do it, identify the people and treat them. And that's how you flatten the curve. So I would say that this is not something which gives us an alarming note as of now. But I would say that, yes, we are on the track.
But don't you think it is a little alarming for what, and that we need to have an explanation, for the city of Chennai? I think, if I'm not mistaken, 80 cases today, Kovai, over 100 cases yesterday. Largely, almost 85 to 90% of the cases are coming from one city now this week.
Today is about 94 cases, not 80. So that puts us about 768.
94.
Yeah,
yes.
But a state like Chennai, which usually used to see about 18,000 to 20,000 of migrant population a day, and now it has been stagnant for almost 30 days. You have the huge amount of close to about 10 million population living in the city. If you take care of the outskirts that has been expanded as Greater Chennai, it will easily house about 1.2 million, 12 million people. So I would say the city is indeed larger in size. So quite naturally, and whatever is happening with vis-a-vis, the results are because of the extensive test that the government is doing in these areas. That's how the WHO also explains to you, like you have to identify your containment zones, do extensive testing, identify the people and treat them. That's how you flatten the curve. So I'm happy that today, 37th district may, only 5 have reported the cases. So 32 cases, there are no cases which has been reported, despite there are tests being conducted in those districts as well. So since there is a spurt in this Chennai area, government has put all the focus into it. So as I gave you the data, almost 3,000 tests are being conducted in Chennai every day out of the 7K tests. The tests are being scaled to 10K, which means that the more focus will get emphasized on Chennai. A mobile testing unit is also being unveiled now. So you have people who are being picked up randomly at the containment zones and the containment areas. I think the guidance which WHO has given or the ICMR has given, the state is proceeding in that direction, and we will definitely flatten the curve in a couple of days from now.
Okay, all right, I will come back to you. I have a few more questions regarding Tamil Nadu and specifically Chennai. But let's talk about some of the other cities that are in focus. Jasmine Shah of the Aam Aadmi Party also joining us. And Jasmine, the city that you live in, Delhi, the city that I live in, Mumbai, have been on top of this list from day one. Our cities have also responded in a very aggressive manner to clamp down, to try and contain infection, but obviously it's a big challenge. Now, what's the sense within the party and the government of the way forward? We are roughly contributing 15 to 20% of the cases of the country right now, and these are coming from Delhi and Mumbai.
That's right, Tanvi. As on yesterday, Delhi had a total number of 3,100 positive cases. But the good news also is that more than 1,000 of them have recovered, which is amongst the highest recovery rates anywhere in the country. So, as far as medical care for those who have become patients of coronavirus is concerned, Delhi has been moving well on that front. So, we have around 2,100 active cases as of now. When we talk about Delhi and Bombay especially, we must acknowledge the fact that as a country, we were slow in clamping down foreign travel to our country, especially from places which we knew or we suspected are COVID affected countries. And Delhi and Bombay, and I would say Delhi especially, had to bear the brunt of that, where almost the first 1,000 cases, the large majority was foreign travelers. And then we saw some incidents due to which there was a sudden spurt. I must say, though, that when we compare the last week, which is the week ending this Sunday, the number of cases in Delhi has gone down as compared to the previous week. So, this is a long battle. We cannot afford to relax. We have to continuously and aggressively keep on testing. I'm happy to share that Delhi today is testing more than any other state in the country. Across Delhi today, as on yesterday, we were at 2,200 tests per million, while the average in the country is 530 tests per million. We are actively containing hotspots and ensuring that there is a sustained set of activities, random screening that is happening in hotspots. And we're also making sure that all those who are affected get taken care of. We are really pushing the trials of plasma therapy, which again, Delhi is the first government in the country which has actively been trialing out plasma therapy. So I think this is going to be a multiple dimension effort on part of Delhi government. And I wish, especially Center at this time, comes out with a strategy to provide additional support and a more focused channel of support for the mega cities which are at the forefront of battling coronavirus.
Yes, okay. Fair enough. Good, interesting point. Let me take that to Dr. Mangesh. Dr. Mangesh, do you agree that maybe a comprehensive strategy is needed for these big hotspots, the biggest of the cities in our country? Because yes, while we may look at relaxation in rest of the country post May 3rd, the restrictions here will continue. But at the end of the day, they are also important contributors in terms of business, economic activity, and there is only for so long that we can continue to remain under lockdown. So what kind of strategy should be deployed?
Okay. See, right now the discussion is totally getting surrounded around the new cases which are coming in more numbers across the urban cities, metros. Okay. Now
you see the origin of these cases whichever are coming. These are coming from the hotspots which are there already. Number two, the origin of the new cases is also seen from the hospitals. The people who are working, healthcare workers, they are there, nurses are there, ayabais are there, sisters are there, doctors are there, quite many. They are also getting affected. So there has to be a strategy which is focused on the hotspots, and there has to be very clear strategy what we are going to work as far as the hospitals and healthcare workers are concerned. Now, as far as hotspot, when we speak about, definitely lockdown is there. We have spoken a lot about social distancing and hand hygiene and everything. When you go to the ground reality, still there are people who are roaming around who are breaking the social distancing and other norms, breaking the lockdown. Now, remember one thing, how many ever tests we do, according to the guidelines, whatever are there, how many efforts we may take, unless there is this distancing strongly applied across the hotspots, the smaller containment zones and bigger containment zones through buffer zones, which are there in between. These numbers are not going to be controlled. This is a reality. We must face that. Very basic thing. Second thing, as far as the hospitals, healthcare workers are concerned, now they all are having PPEs and other things are there. What is most important as far as the hospitals are concerned for the healthcare workers, staff, doctors, everyone? Number one, even if PPEs are there, the training about utilization of these PPEs is very important. Even if slightest of a problem is there in how to use the PPEs, it can give rise to the spread of the infection. Second is the infection control protocol. Every COVID facility, there has to be very strict infection control protocol, prevention and control protocol, which I have my doubts, serious doubts about it, the way healthcare workers are coming in. So protecting healthcare workers and doctors, very strict infection control protocol is very much necessary. These are the two things we have to. And the third thing, as it has been, we have mentioned so many times, the lockdown period, till we see the surge of the cases in India. Fortunately, we had a breathing space as compared with the other countries and Europe and US. We have to utilize this lockdown period in building our healthcare for the surge, which is going to be expected. So now the gap which is there, the current healthcare delivery system, what India holds and what is necessary when the surge comes, the gap is quite wide as compared to the US and other developed countries are there. And the experience from the other Western countries, what we have seen till now is not really very good, in spite of they having very good healthcare facility as compared with India. So when we are coming at the closure of the lockdown too, and we are also expecting the surge of the cases, we definitely have to work on this healthcare delivery, which is due in this coming time, next fortnight or so. Thank you.
Tanvi, can I check
Dr. Mangesh, if I can ask a follow-up question.
Yeah.
Yes, go ahead, please. Yes. Kovai, you wanted to make a point?
Yeah. Yes. What the doctor say is correct, because there is a circular from the central government on the model micro plan, which says that you have to earmark a 3-kilometer radius and you do intense survey and search in these areas for asymptomatic people and people who have symptoms as well. So the state has already initiated that with a 5-kilometer radius last month. So I would say there are 15 zones in Chennai and there are about 200 wards. There is a door-to-door screening that is happening every day, checking on people about the symptoms. Do they have any, whether it is symptoms of flu or is it related to fever or headache or anything of that sort? Does the family has got any travel history, or have they met anybody recently, any relative or anyone who had travel history? And so there is a database. I would say that the state has completed about close to about 1 crore screening of people in the city of Chennai. So as and when the rollout of the next stage after May 3rd, whether or if there is an ease of movement of people in non-containment zones and how to go about containment zones, I think each and every state has its own onus to do that, where they have to go to the next stage. So as far as TN is concerned, this is a strategy. There is a home-to-home screening which is happening for the last 1 month. So there are symptoms and the areas are being earmarked where there are symptoms which is being shown. Those are all the areas which is being given priority for testing. So that's the reason why we are able to identify precisely the hotspots that is emerging out of within Chennai itself. There are 3 zones in Chennai which is emerging as a hotspots. So that's the kind of work which the center also expect a state to do. And I hope that with the help of the people around in the containment zones, if they are being able to screen, majority are being able to screen, I think every state by itself will be able to move to the orange and the greener very soon. And to add that point, next to Delhi, Tamil Nadu has got the highest
Well,
testing.
we hope so, because Kovai, it's been. That's true. That is true. You are doing a high amount of testing, and in proportion, the number of cases are also emerging. But it's just sometimes mind-boggling that if we've been in a lockdown for 5 weeks with absolutely no movement that's taking place, then why is it that even in a 5th week and 6th week we're actually seeing such high number of cases? Could it largely be, Dr. Mangesh, because we are doing more testing, or somewhere this lockdown hasn't worked in some parts? How is it that after 5-6 weeks of lockdown we are still seeing these cases?
Definitely, lockdown is most important and it has worked. No one can say or argue that lockdown has not worked. 100% lockdown has protected India. Point number 1. Now, point number two, as far as testings are concerned, you are saying that is it correct or less number of testing is done? My point is very clear because I work at a grassroots level, At grassroots level, what is happening? The most important principles in the testing is that each suspect needs to be tested. Point number one. Point number two, there is something called as a window period. This window period needs to be considered. Now, the knowledge of this window period, taking into consideration this window period and retesting the suspect if he is having symptoms or he is not having symptoms. There are a few cases across the country where there was a crowd or gathering of the crowd. Now, few people were tested there and they came out to be negative and later on they came positive. So this is something called a window period. This window period needs to be addressed everywhere. So it is not that testing is not done or testing is done. It is how and when testing is done that is very important, considering the window period. That is more important. Another thing is that as far as there are two rapid tests and PCR is there. Again, where the rapid test should be applied, where the PCR should be applied, that is another thing that has to be categorically applied upon. People have got this this thing that rapid test is negative. I don't have corona. No, it's not like that. So they need to be counseled very properly. And all these guidelines and everything, testing guidelines, when to test, where to test, what is window period, it has to go across the country in their local languages. That is very important. That I have been telling from the day one. That is very important. So there is a slight misunderstanding, miscommunication, which needs to be addressed as far as tests are concerned. It is not that we are not testing and we don't want to test. It is not like that. Everywhere tests are happening, definitely. But as far as suspects are concerned, new cases are concerned, we have to apply our mind, professional mind, and do this test. And I will urge to the government, it may be union or state government, whatever it may be, as far as management of COVID is there, all such things are there, protocols about testing, guidelines. The professional help of the doctors is very much necessary. Sometime back when we were speaking about the infection control protocols to be applied in the hospital, there are experts about the infection control who deal with this, how to apply the infection control protocol and how to maintain it. These experts must be involved in taking decisions, in policy making. That is most important. There are good physicians and this thing across India. These doctors should be actively involved in the policy making, in guidelines making. And lastly, I will say that there is a direct need of a vigilance committee at every level. Whether whatever guidelines we are giving, they are executed, implemented very properly, that is very much necessary. So unless we audit each and every contact, each and every case, this is not going to be complete success, remember. And that is very much necessary here. Thank you.
Okay, thank you so much, and I agree with you. Some amount of scrutiny is also required, and audit is also required to ensure, that norms are being followed and it's being properly implemented. I believe we've also got Dr. Hemant Bhatt of the BJP joining us right now. Dr. Bhatt, Ahmedabad was one of those cities like Chennai that didn't have too many cases to begin with. But good evening. But in the last few days, we've seen a rise in cases in Ahmedabad. It's now become one of the hotspots and largest contributors to cases in India. What's going on in that city?
I think the first and foremost thing that the Municipal Corporation of Ahmedabad has adopted is the most important thing of chasing the virus instead of virus chasing us. Let me tell you that Ahmedabad local administration is in a proactive manner, I would say, that they are conducting almost on an average 2,700 tests per day. And as far as Ahmedabad is concerned, out of 48 wards, only 6 wards are there where they are in the red zone, while about 42 wards are in the orange zone. And as far as the spread of the infection is concerned, because of this active surveillance, we have dug out a lot more cases which were asymptomatic. You'll be surprised to know that more than 80%, in fact, 81% of the cases are asymptomatic patients or are having very mild symptoms. Unless and until we have done this kind of an active digging out of the cases, Ahmedabad would have seen a catastrophe in the coming 15 days or a month. So I would particularly be happy and congratulate on behalf of the people of Ahmedabad to the local administration as well as the government of Gujarat for doing this active surveillance. This has helped a lot. And the most important other thing is that out of these 6 wards, all these 6 wards are in the walled city. You see, on 19th of March, Gujarat was having the first case of COVID-19 positive. But after that, we have seen a kind of a spike. After about 250 persons from a workers returned from Delhi, and they have resided in the walled city. If you know the geography of the walled city of Ahmedabad, it is around a 5 square kilometer area, and it contains about 5 lakhs population, and it is a very densely populated kind of the residency. And in that case, if these active 250 persons who have come from Delhi, they have led to a kind of a catastrophe that we have seen in the first case, and we have seen a very high spike in Ahmedabad. But looking ahead of another 10 to 15 days, as a medical practitioner, I am very hopeful that because of this digging and active surveillance, Ahmedabad is going to flatten the curve. Ahmedabad is going to see the increase in duration of the doubling rate of the cases. Previously, we were having around 4 days of doubling duration. We are hoping that within coming 2 to 3 days, or in fact, I would say that within last 2 to 3 days, the doubling rate is around 7. And if we can just pull it up to more than 10 days, it will be a great thing for Ahmedabad. On any given day, there are 7 medical vans of Ahmedabad Municipal Corporation consisting of 6 medical officers. They are moving in Ahmedabad for an active surveillance. Also, what you call it the super spreaders, like vegetable vendors, the kirana shops,
Yes.
the people who are in the essential services, there has been an active surveillance of those super spreaders. And just 2 days ago, 4,500 active surveillance was done or testing done of these super spreaders. And we have dug out around 30 to 40 positive cases out of that. So this targeted approach is a wonderful thing which has been done in Ahmedabad. And I'm very hopeful that the amount of the efforts that has been put in by the local administration, if you see the COVID hospitals, 1,500 bed hospital of SVP, 1,200 bed hospital of civil hospital, the COVID care centers, a 2,000 bed, a fully equipped Samras hostel for less symptomatic patients, even COVID care center of another 3 hotels, the Fawn Hotel, the Lemon Tree Hotel, the Doubletree by Hilton Hotel, and the amount of an effort that has been put by the local administration. I'm very hopeful that the Ahmedabad will see through this a kind of the hike of the cases, and we will see a flattening of the curve in a very short days in the near future.
Okay, you raised a very important point, and that's about the super spreaders and carrying out surveillance and identifying those cases where people who are in essential services. And like you said, there were 23 new super spreaders that were identified on 27th in Ahmedabad. There were vegetable vendors, those working in kirana stores, those supplying milk. I'm given to understand 4 milk vendors also tested positive. Jasmine, that's an interesting, way of also tracking and containing infection. Those who may be in essential services in the front line and already infected. Is that something that you've also noticed in Delhi and are closely tracking?
Yes, absolutely. And I think these are very effective strategies. And just like Ahmedabad is doing it there, in Delhi as well, we have identified who are those at the front lines of giving essential services. I'll give an example that Delhi has probably the largest scale relief assistance program in the country. If you look at it per capita, we have more than 1,500 food relief centers feeding 10 lakh people lunch and dinner cooked meals every day. So one such volunteer who was engaged, this is a civil defense volunteer, was showing symptoms, and we later tested and found that he was corona positive. Immediately, the chief minister ordered that more than 2 or 3,000 people who are at the forefront of this food distribution should be tested. Similarly, over the last 3 or 4 days, all the journalists who are actively reporting from the ground in Delhi, around 530 of them, Delhi government carried out free testing, and fortunately, we found that only three tested corona positive. Then the nurses, the sanitation workers. We are also talking about the policemen who are doing tough duty on the ground all times of the day, and especially in containment zones where it is the police and the district administration that is also providing essential supplies to people at the door level, which again is a very risky job. So, in terms of testing, we are doing targeted testing. We are doing random testing inside containment zones, because inside containment zone it is difficult to predict how the virus would have spread. So we have even gone for random testing, and then of course we do symptomatic testing at all our hospitals, as well as 21 dedicated COVID testing centers that Delhi has again set up, and all of this is done for free. So clearly, aggressive testing has been at the forefront of our strategy, but at the same time, trying to ensure that containment zones are very well managed. And a very systematic set of activities, which in Delhi we call it Operation Shield, is implemented so that containment zones are contained. And we are seeing now that many of the containment zones that were first sealed have started being de-sealed, which is the good news, that for 28 days we are seeing that no new cases of coronavirus in some of our containment zones. It's a small number, but we are expecting that with this focus strategy of Operation Shield that we are adopted in Delhi, more and more containment zones will start opening up, and that is how we will get the confidence to open up the city.
Okay, and of course these big cities, these 7 metros, and I'll again go through them. There's Delhi, Mumbai, there's Indore, Ahmedabad, Pune, Hyderabad, Jaipur, and a growing concern now, which must be in the spotlight so that it doesn't get out of hand, is Chennai. These are the cities that largely need our attention right now, that hold key to our battle against coronavirus. Dr. Bhan is back with us. Dr. Bhan, can you give us some insights into what's happening in Indore? Of course, there was this news that came out with certain experts. They claimed that a new kind of strain, a mutated strain, which was reportedly deadlier, has been detected in Indore, but we understand that's under investigation. But what's happening in that city?
So a few things. I think, I probably will make some general comments and then come to Indore. One, I think, while I am cognizant of the fact that we obviously need to do targeted testing, as some of the other panelists said, I also want to point out from a public health perspective, we should be careful about using stigmatizing words like super spreaders. These are individuals who are providing essential services, and they are at risk because of the nature of that. And to ascribe them as being guilty in some way by calling them super spreaders, we might also be stigmatizing them and making it less likely that people might come forward for testing. The second thing is testing by itself seems to be very variable.
Valid point,
among the cities that you counted, we heard of examples where there has been aggressive testing happening. But in cities like Hyderabad, just today there was a report in the evening which was published which said that they had only done around 200 cases over the last 24 hours or so. And that seems to be much, much lesser when the number of cases are fairly high for the city. Now, Indore also has a peculiar problem. Actually, the whole state of MP, there is a capacity issue. We have a lot of samples which are waiting to be tested. There is not enough capacity within the state. Many of these samples are being sent to states like Delhi and Puducherry, which actually have their own backlog. So by the time actually these samples tested, results will be communicated back to Madhya Pradesh and then be actioned. Probably there is a possibility that those who have been tested might further spread the infection. So it points again to a capacity problem. It's not just enough to do sampling. You also need to have the capacity to run those tests and make sure that that is done fast enough and those results are communicated. The third issue, I think, in MP specifically has been a very high number of individuals who either work in the health services or work in areas like civil defense, police, etc., who've been infected. That points to a problem that there is clearly either been poor quality personal protective equipment or not enough training or orientation on using it, because these are individuals who are at the front line and they should have been protected. And by virtue of actually being infected, they might have put a lot of other people at risk of transmission of infection. The other element I think which is important is, we heard a lot about flattening the curve, and it's important certainly to flatten the curve, but it is also important to keep it flat once you've flattened it. And we need to learn from the examples of many other countries which have struggled with that. Post the 3rd May scenario, I think we're going to have serious problems. There is a high chance that we will have rebound social interactions as we lift the lockdown, whether gradually or en masse, depends on what they announce. But we need to be extremely careful that we need to keep our transmission rate very low. And for that, obviously, you need to keep doing enough testing. You need to keep doing public engagement to ensure that social distancing, specifically physical distancing, hygiene measures, and adherence to usage of masks, etc., is something people really follow. And at the state level, I think this is where the leadership needs to happen at the district level as well. And all of these cities, which are going to be our economic centers of commerce, interaction, even in the post-lockdown era, are going to be also important for us to respond to, because if we don't do enough to control the spread of infection there, this could easily mean that the infection further spreads into rural India. And we have talked in the past how we have all concerns about the state of our health system in rural areas, and we don't really want a situation where this is spread widely enough in rural India, and then we will certainly have a situation where there is a possible collapse of the health system. So again, it's very important for us to recognize and identify these centers where there seems to be higher numbers, and work towards control now. Otherwise, we could have a serious problem coming up in May.
Yes, absolutely. And we have to keep in mind that as different parts of India hope to see some kind of relief post May 3rd, parts that have largely been unaffected by COVID, and there are roughly about 300 districts that have had no cases in the last many weeks. There will be these cities which will continue with their battle, and it's perhaps going to take longer than beyond, and will take more than the May 3rd deadline. But Kovai, if you're still there, I know you had to leave, but very quickly, what's the extent of preparation that the administration has managed to do in these 3 districts, additional healthcare infrastructure that now you may have as the cases continue to go up?
Yeah, Tanvi. See, as far as the districts are concerned, wherein the zones are being earmarked, as I pointed out earlier, the house-to-house searching and screening is already been in place. That's the reason why testing are being targeted, like how the panelists are suggesting about targeted test. It's already being done. There is a saying in management, something called an AIDA model, AIDA. That's what our CM is also following. Awareness, interest, desire, and action. And just 10 minutes ago, he has given one news for the containment zones, wherein they will create the maximum awareness in the containment zone. They will create interest in the people by giving free sanitizers, masks, and 250 grams of disinfectant powders in those containment zones, so that there is a desire and action being percolated among the people to stay safe, stay at home, and practice that social distancing. And as and when the tests are being conducted extensively, we hope that the curve will be flattened, and definitely there is always a light at the end of the tunnel. So everybody hopes for the same. Even the global scenario is such. So we hope that we intensify these testing still further. As far as testing is concerned, we don't have any scarcity. We have about 41 testing centers so far in the state, including the private collaboration. And as far as the flagship program of Amma Canteen is concerned, which is churning out close to about 8 million meals a day, which by far is the highest in India. So there are structured programs which can take care of them both economically as well as emotionally. So I would put it in this way, that the state is all geared up to ensure that this pace gets out of us very fast.
No, but I was more talking about from the point of view of beds and ventilators and quarantine centers and COVID-free treatment centers. Just take city of Chennai for example. Now you have 768 cases and roughly 100 that have come today itself.
That's what I'm saying. 768 from the beginning. If you minus the discharge cases, it will be about 440, close to 440 active cases. The state in totality has got about 150 beds ready with us. 5,000 plus ventilators are ready. So if you look at the number of positive cases, when we did the sampling of 550 people turned out to be positive in the initial days. So there was a high approach saying that 10% of the population is going to be positive cases. So we need to increase the testing. When we increase the test to 1,000, when we increase the test to 3,000, when we increase the test to 7,000, the number of cases turning out is 100, which is almost close to about 1.3% of your testing ratio. So out of that 1.3 population, you hardly need about 2% who would be requiring that respiration difficulty, who would be requiring that kit. So the state is well prepared when compared to the neighboring states. Yes, there are 5,000 plus ventilators are available. The entire state in totality has got about 150,000 beds. So as far as the infrastructures that has been created for COVID, by far Tamil Nadu has the highest in South, I would say. So the state is well prepared. Even the team, if you say that 50% of them have been discharged, so you can understand how the entire medical fraternity had gone about addressing this issue with respect to the age-wise breakup and what kind of treatment to be given, how to address it. That's the reason why the number of discharges are high. Even for your kind information, the state still not has not started plasma therapy because ICMR has sent out a guideline that this is not a very proven methodology to follow. Yes, Houston started it last month where 3 people were discharged, but plasma therapy, if not administered properly, could lead to a lot of complication and consequences. So without the plasma therapy, if the state is able to discharge 57% of its, almost 1,168 people got discharged. So I would say that the mechanism in which the state government and the leadership of our CM is doing a phenomenal and a good job. All we are praying is that this COVID ends very fast and let's all get back to the normalcy at the earliest. So I know it's a long road, but still we would say that we have gone by the guidelines, we are meticulously following it, and the RCM is leaving no stone unturned for whatsoever reason it is, be it economic package or be it welfare schemes or be it beneficial schemes or be it announcing 50 lakh for the frontline workers and the government staff and motivating them. There is a 20-minute motivational talk happening every day, how to use PPE kits and how to keep motivated in every hospitals, in COVID hospitals. So I would say that they have done.
Well, as long as they all have PPE kits and gloves. Because Kovai and not just about Chennai, where reports have come in the past about not having the right kind of protective gear. In the city of Mumbai, we have instances of ASHA workers who are going door to door in the slum areas for audit purposes and who are not given the proper protective gear. In Delhi, in Noida, in fact, our own reporter came across the set of healthcare workers who were given a stick to use to ring the doorbell with no gloves, as they go from door to door collecting data. So there's always scope for improvement, but yes, of course, the information that you're sharing for us with us is good to know if these steps are being taken. I also, on the same lines, very quickly want to go back to Dr. Bhatt and ask him, Dr. Bhatt, 5 weeks of lockdown has also given us time to build on our healthcare infrastructure. What's the extent of number of beds and ventilators, and quarantine centers that are now available in Ahmedabad as the number of cases continue to rise?
The state is well prepared as far as tackling the corona onslaught. I would say that by next 4 to 5 days, we will be having a 20,500 bed capacity as far as admitting the patients of the corona is concerned. As far as Ahmedabad is concerned, we are having around 1,500 ventilators in the government-run hospitals, whether it is SVP hospitals or a civil hospitals. And as far as across the Gujarat, we are having more than 4,000 ventilators capacity, even including the private hospitals and the nursing homes. But let me tell you that we have seen that more than 81% of the cases are either asymptomatic or having a very mild symptom. As far as the patients on ventilators are concerned, fortunately, with God's grace, we are having not that much of number of patients who are on ventilator. If you see it today, there are 24 patients who are on ventilator in SVP hospital, which has a capacity of 1,500 bed patients. So I think the state is well prepared as far as the increasing the capacity of the corona care centers, as well as admitting the patients of the ICU. There are about 1,500 ICU beds and 1,500 ventilators right now in Ahmedabad. So in a way, the most important point I would like to stress upon at this juncture is taking an example of a local administration. A particular area called as a Ramapi Tekra in Vadaj, where there is a 25,000 persons population. There was a mass screening within 2 days, and they have identified 250 suspected cases. And out of that, the active surveillance was done, and 5 to 7 active cases were identified. Similar way, entire Wall City has been mass screened right now. and we have dug out all the active cases from that area, fortunately. Even our commissioner today only, he has said that the corporation is going to distribute 3.5 lakh face masks as well as the hand sanitizers free of charge to all the vendors. We are telling them super spreaders only technically. We are not going to tell them personally when we are meeting them that you are a super spreader. It is only a technical term, but we are going to distribute the face masks. We are going to distribute the hand sanitizers to them free of charge. We are going to distribute the banners where there will be an instruction to all the customers who are visiting these centers of essential services that what precautions they have to take. So I think in a way, the local administration and the government of Gujarat is all geared up to tackle the COVID crisis. And the way the active surveillance has been done, the future looks very bright as far as the next 10 to 15 days which are coming.
Well, I hope so, but Dr. Bhatt, I think there is merit to what Dr. Anand Bhan was saying about using such terms. You may not actually label them and call them that directly, but once officially we start using these terms, then others do too. And then it gets caught up in the media, and
Tanvi, I would like to make
neighbors
a
start
point.
using it, and local authorities on ground start using it, and unfortunately, maybe subconsciously we do add to that stigmatization of the entire process. I'm completely out of time. I'm sorry, but I'm completely out of time. But I will have to thank all of you. Yes, at this point, I will just say these are the cities to watch out for, and it's a tough task for state governments and the city authorities because of the crowd, sheer number of people, sheer load of cases on these cities, and the fact, of course, that these cities also form a very important part of this country's growth, and a large population lives in these cities, which is why it's important to tackle these cases smartly, tackle them quickly, and bring the number of cases down. Remember, viewers, only 7 cities contributing to almost 50% of the cases in our country today. We win this battle, half the battle is won just like that against coronavirus, at least for now. Of course, the infection isn't going away until we find a vaccine, so that's a separate long-drawn battle. But as the entire country discusses what happens post May 3rd, it suffice to say that for these cities is going to be more than a lockdown ending on May 3rd. Beyond that, we will be looking at a longer battle. Thank you so much for joining us on this conversation. Well, let's get you the latest as far as the education calendar is concerned for students, and here's the latest that we've got from UGC. And remember, Mirror Now has been tracking this story constantly for you. Here is some clarity that's coming in as far as reopening of universities is concerned. UGC has actually issued guidelines for reopening colleges that admissions can actually begin from August and classes are likely to begin in September. This is the latest coming in, but Ayushman actually has most of the details, so let's just quickly go across to him. Ayushman, what's the latest that UGC has issued?
Tanvi, the UGC has said that it has issued the new academic calendar, which we were waiting for a while. And in this calendar, they have said that the session for freshers in the universities will begin from September, and the students who have already enrolled, their sessions will begin in August. It has also said that intermediate students, the students who are in the midst of the semester, they'll be graded based on the assessment of the present and the previous semester. In the states where the COVID situation has normalized, there will be examinations in the month of July. And it has also been recommended that the extension of 6 months should be granted to MPhil and PhD students, and Viva Voce should be conducted via video conference. And this is all the guidelines that has been issued by the UGC, Tanvi. And it has also been said that the examination, while taking the examination, the universities should maintain the norm of social distancing. If that option is not available, 50% of the assessment should be done from the previous semester, and 50% of that should be done from the internal assessment. Also, the examination time, which is of 3 hours, that should be reduced to 2 hours. These are few of the recommendations which has been done from the UGC side for the new academic calendar, Tanvi.
All right, Ayushman. So this is a big decision that's come in. Some amount of clarity, at least for students looking to seek, admissions in various colleges and universities. This is roughly the timeline that the UGC has put out now. Let's wait and watch how things really pan out. Thanks, Ayushman, for getting us this story.